Question, the member from the member from Carleton, Mississippi Mills.
Thank you, Mr. Speaker. My question is for the Minister of Health and Long-Term Care. Minister, your management of our healthcare system is a failure. You are cutting physiotherapy for seniors. You are cutting home care for people who want to be at home. You are cutting funding to hospitals, and nurses are being laid off. And now you are cutting fees for services paid to doctors.
What a surgeon.
Our doctors are the foundation of our healthcare system. They are not your employees, they are your partners. Your partners in healthcare delivery. You are not treating them with the respect that they are due. You are not dealing with them responsibly. You are not negotiating in good faith. Minister, will you talk to our doctors in the mutually respectful manner they deserve? The integrity of our healthcare system is at stake.
Thank you. Minister of Health, Long-Term Care.
Stand up for the PSW.
Well, Mr. Speaker, it's partly because we are increasing our investments into community and home care. It's partly because we are increasing our investments in hiring more nurses and making sure that we're investing in those aspects of health care that truly do support our seniors and other vulnerables in society. That we've asked our doctors to help to work with us in this difficult challenging fiscal time to actually pause in terms of the remuneration. And that's all we're talking about here, Mr. Speaker. We're talking about the compensation that the government provides to our doctors. And what we've done after a year of negotiations with the OMA, we brought in an umpire, Mr. Speaker. We brought in retired Justice Warren Winkler to actually bring the two parties together to try and reach an agreement. At the end of the day, we were unable to do that. Judge Winkler implored the OMA to accept our offer. They didn't, but we were going ahead and implementing precisely what Winkler had recommended.
Thank you. Supplementary.
Minister, there are 28,000 doctors in Ontario who treat 320,000 patients every day of the year. Our population grows by 140,000 people every year, and our aging, high-needs population is also growing rapidly every year. The demand for Medicare in Ontario grows by 2.7% every year, and yet government has committed to fund only a 1.25% or less than half of that growth. Dr. Stephen Gradinsky, a pediatrician in my riding, tells me that 2 pediatricians are retiring in Ottawa, and there are no new doctors to replace them. We need more doctors, and your response is to cut fees for services paid to doctors. That is not going to work. This is a major disincentive for doctors to practice in Ontario. Minister, think of the 320,000 patients per day. They need our doctors. Will you get back to the bargaining table and do what is right?
Thank you.
Well, Mr. Speaker, the fact is that we actually have more than 5,000 more physicians than existed in Ontario when we took office and when we came into office in 2003. But, Mr. Speaker, our doctors are precious to the healthcare system in this province. I'm a family physician and a public health expert myself, and a member of the OMA, Mr. Speaker. I had the privilege just 2 days ago of sitting down with Dr. Michael Toth, who's a family doctor from southwestern Ontario, the new president of the OMA. We had a very positive and engaging discussion. I know my ministry is actually sitting today again with the OMA as part of the Physician Services Committee to look at ways that we can move forward and come back to negotiations and discussions. There are many, many important issues that we depend on our doctors in Ontario to help us work through. They are important partners. They are a big part of the foundation of healthcare in this province. I look forward to continuing to strengthen that relationship and working with them, Mr. Speaker.
Thank you. New question, the member from Windsor West.
Thank you, Speaker. My question is to the Premier. Speaker, the Minister of Education has